Chemotherapy can be an effective treatment for biphasic mesothelioma, but it often comes with significant side effects as the drugs work to destroy rapidly growing cancer cells throughout the body. Some of the most common side effects of chemotherapy for biphasic mesothelioma include fatigue. Chemotherapy can cause extreme tiredness and fatigue, as it demands a lot of energy from the body to fight and recover from the effects of the drugs. Fatigue may be both physical and mental, and can last long after treatment ends. Nausea and vomiting. Many chemotherapy drugs are highly emetogenic, meaning they can cause nausea and vomiting. This is usually most severe right after treatment but may persist on and off for days. Good antiemetic medications help control this side effect for most patients. Low blood cell counts. Chemotherapy works by attacking rapidly dividing cells. This unfortunately includes crucial blood-forming cells in the bone marrow. Low red blood cell counts, anemia, can cause fatigue and shortness of breath. Low white blood cell counts increase susceptibility to infections. Low platelet counts can lead to easy bruising and bleeding. Periodic blood testing allows the medical team to monitor counts and manage any issues. Hair loss. Chemotherapy damages hair follicles, often resulting in significant hair thinning or balding all over the scalp and body. Hair loss usually begins within 2 to 3 weeks of treatment and new hair may start regrowing once chemotherapy ends, though it may regrow differently in color, thickness or texture. Mouth sores. Chemotherapy can damage the lining of the mouth and cause painful mouth sores, ulcerations or an infection called candidiasis. Good oral care is important for prevention. Mouth issues can impact food intake as well. Diarrhea. Some chemotherapy drugs interfere with normal GI tract functioning and disrupt the balance of gut bacteria, potentially leading to frequent loose or watery bowel movements. Anti-diarrheal medications may help manage this issue. Nerve damage. Certain chemotherapy drugs are known neurotoxins that can injure peripheral nerves, resulting in tingling, burning or numbness in the hands and feet. Peripheral neuropathy. Nerve function may gradually return once treatment ends but damage may become permanent in some cases. Memory and concentration problems, known as chemobrain or cognitive impairment. The subtle impact of chemotherapy on brain functioning can cause issues with focus, attention, learning, multitasking, and memory. This is usually temporary but may persist long-term in some cases. Fatigue and sleep issues. Beyond extreme tiredness and low energy levels, chemotherapy can disrupt normal sleep cycles leading to insomnia, difficulty staying asleep or early waking without feeling rested. Melatonin or other sleep aids may help manage chemotherapy-induced sleep issues. Mood changes. The stress of a cancer diagnosis and treatment on the body and emotions may contribute to feelings of sadness, depression or anxiety in some patients undergoing chemotherapy. Support groups or counseling can provide helpful coping strategies. Menopausal symptoms. Women undergoing chemotherapy, especially those of childbearing age, often experience sudden menopause as treatment damages ovarian function and triggers early menopause. Hot flashes, vaginal dryness and mood changes are common menopausal side effects that require management. Hormone replacement therapy may help control some issues. Nail changes. The fingernails and toenails may discolor, thicken or develop depressions or ridges during chemotherapy as nail matrix cells are compromised. Nails usually return to normal once treatment ends. Skin and soft tissue changes, rashes, itchy skin, dryness and discoloration are potential dermatologic side effects of chemotherapy that typically resolve once therapy is discontinued. Radiation therapy compounds skin injury risks. Taste and smell changes. Altered or diminished ability to taste food flavors or smell scents commonly occur with certain chemo drugs early in treatment. Taste and smell sensors recover their function once chemotherapy completes. Heart damage. Some anthracycline chemotherapy agents cause potentially irreversible heart damage over time, increasing risks for heart failure if high cumulative doses are used. Careful cardiac monitoring allows for dose adjustments or substitutions as needed to avoid this serious side effect. Secondary cancers. Due to inherent risks of damaging DNA with chemotherapy toxins, some studies indicate a potential long-term increased risk of developing treatment-related secondary cancers like leukemia. However, the survival benefit of chemotherapy continues to outweigh the small risk for most cancer patients, including mesothelioma. As illustrated, chemotherapy comes with significant potential side effects that diminish quality of life during and even after treatment. However, managing side effects aggressively with anti-emetics, growth factors, skin creams and palliative care can help patients tolerate therapy reasonably well in hopes of shrinking their cancer and gaining more months to years of life. The medical team aims to safely deliver maximum dose intensity while preserving organ function and the patient's functional status to the greatest extent possible. With multidisciplinary supportive care and newer drug regimens, many mesothelioma patients are achieving better tolerability of chemotherapy and improved outcomes today compared to past decades. Chemotherapy side effects for biphasic mesothelioma treatment can impact many organ systems and aspects of daily living. Close monitoring, proactive side effect management and optimizing supportive care measures are priorities to help patients complete their chemotherapy as planned whenever the anticipated benefits outweigh the costs of therapy. With a coordinated, multidisciplinary care approach, many patients are able to sustain treatment and derive meaningful clinical benefits from chemotherapy, even while navigating short-term side effects along the way.